Well, I'm here with Gaston from Oasis of Hope in Mexico, and thank you for taking a few minutes to share with us about the hospital and what you guys do there.
Perfect.
So a lot of people have heard about Oasis of Hope, and I was so glad that you were here. So share with us, what exactly do you offer for cancer patients at Oasis of Hope?
Well, before that, thank you, Elise, for this opportunity. It's a pleasure to share the Oasis of Hope mission with you and your fans. So, Oasis of Hope is a cancer treatment center located in Tijuana, Mexico. We've been around for about 60 plus years now, and over 100,000 patients have gone through our doors.
Wow.
It started off as a lateral center for patients in the U.S. looking for alternative treatments outside the country, and it used to get about 20 new patients a day back in the 60s and the 70s, and it has developed into this integrative treatment center where we combine the best of alternative with the best of conventional treatments. And the great thing about Oasis is that we're a hospital, so all patients stay at the hospital. We have an OR, we have ICU, and we have 24-hour nursing, 24-hour doctors. So our treatment center is really for everybody that's interested in receiving integrative care from specialized oncologists that have been doing it for a long period of time.
Yes. One of the questions that I always get asked, and even for myself, is the safety of Mexico.
Yes.
And I'm sure you get that a lot too.
I do.
And so share with us how someone would come to see you and how their safety would be protected.
Sure. The great thing about Oasis is, well, before that, we're located in Tijuana, Mexico, so it's right across the border from San Diego. So about 98% of our patients are from abroad. So we're specialized in medical tourism, this new genre that's been happening. So patients that come to Oasis are fully under our let's say our care.
Mm-hmm.
So all patients fly into San Diego, California, which is right across the border from San Diego, and Oasis is located about 30 minutes away from that airport. So we pick you up at the airport, we bring you down to the hospital, and Oasis is a campus. So it's a cancer center within a hospital, and there's no ER, there's no outside consult. So only cancer patients are at the hospital the entire time.
Okay.
So you're under our care completely. We have security outside and everything, so we've never had an issue. The only issue we've had is patients being lost sometimes when they go to the beach or something. But to be honest with you, it's never been an issue.
Okay.
I know Tijuana has a negative connotation, but I'm from there. I'm from there.
Okay.
A lot of people say, "Oh, you're in Mexico because you do alternative treatments," and I always say, "No, we're in Mexico because we're Mexicans."
Yes.
So
yes.
it just so happens that the Mexican FDA is a lot more lax when it comes to the treatments that we can offer.
That's wonderful. So you do conventional treatments and integrative treatments at the same time, or is it just integrative care that you do?
That's the great thing about Oasis. We provide the best recommendation. Period.
Okay.
If that is combining a little bit of low-dose chemo and radiation with our treatments, we do that. If it's just strictly alternative, we do just strictly alternative treatments. So all patients, when they're interested in our treatments, they send us their medical records. Our admissions doctors review that information, and we provide a free Zoom consultation with the patients and their loved ones.
Okay.
And we talk to them about their current situation, about their current diagnosis, and we walk them through a recommendation.
Okay.
And if they're interested in becoming patients with us, we send them the protocol, and when they're ready, they send us their flights, and we basically just take care of them from that moment on.
That's wonderful. And so I know every case is different, every situation is different.
Yeah.
But what is the average amount of time that someone stays with you at Oasis of Hope, and what is the typical costs?
That's great question. So typically, new patients stay anywhere from 2 to 3 weeks.
Okay.
Okay. It depends on the recommendation and also the physical condition and also what kind of treatments they're interested in. All patients come back about 3 months later for a second cycle.
Okay.
And after the second cycle, it really becomes very personalized. Some patients come back every year, some patients need more treatment, come back every 3 to 6 months. But typical cost for the first cycle is anywhere from $25,000 to about $40,000.
Okay.
And subsequent cycles are from $12,000 to $20,000. There's a big difference because recommendations do vary by cancer type, cancer stage, and the physical condition of the patient.
Okay. And does any form of U.S. insurance cover or
We wish, but we work with medical reimbursement companies.
Okay, like the
that for-
HSAs.
HSAs and also like medical bill gurus. There's some companies that really do great work in terms of reimbursement. They might not reimburse the alternative stuff, but they can or they may reimburse hospital stay, consultations, lab work, PET CTs, all more of the standard conventional standard of care. Yeah, so it's a combination.
Wonderful. Well, thank you so much for taking these few moments to share with us and let us know more about Oasis of Hope. And
Thank you.
yes, thank
Well,
you.
if anybody's interested, go to our website at oasisofhope.com and learn about us. And thank you, Elise. Thank you so much for this opportunity.
Yeah, thank you.
All right.